Hey, welcome! Today, we're going to be diving into something that sounds pretty intimidating, the pinched nerve in your neck. It feels awful, it sounds serious, but we're going to break down what's really happening and, more importantly, talk about the proven powerful ways you can get better.
Yeah, this quote just hits the nail on the head, doesn't it? When you get those shooting pains zinging down your arm, scary is exactly the right word. It's sudden, it's sharp, and it's totally normal to feel alarmed. But understanding what it is, well, that's the first step to taking control. All right, so let's shift from that feeling of panic to the actual facts. What is really going on in there when we talk about a pinched nerve? Let's get into the specifics. So the medical term is cervical radiculopathy. Now, here's a really key distinction to make. Radiculopathy itself is when a nerve root in the neck is irritated enough to cause actual neurological loss, changes in your feeling, your reflexes, or even your muscle strength. But the symptom, that shooting pain, is called radicular pain. And get this, you can have that terrible pain without having the full-blown neurological condition. That's a really important piece of the puzzle.
And this image shows it perfectly. Just look at that pattern in panel D. See how that red line travels from the neck down into the arm? That is the classic map of radicular pain. It's not just some random ache. It's literally following the path of that annoyed nerve root. It's why you can feel it so far away from your neck.
Okay, so we've defined the problem, and I know it sounds serious, but I want to immediately switch gears here because there is some incredibly good news. Despite how bad this can feel, the outlook is actually amazing.
And that's really the main headline for this section. Your body is just fantastic at healing itself. The research is super clear on this. With a bit of time and the right game plan, things almost always get a whole lot better. Let's look at the numbers.
First off, the long-term picture. This is huge. Around 90% of people are either completely fine or have only very mild symptoms after a few years. Just let that sink in. For the vast majority of people, this is not a life sentence of pain. Not even close.
But you're probably thinking, a few years? I need relief now. Well, here's more good news. You probably won't have to wait that long. A staggering 83% of people see major improvements within just 4 to 6 months. So your body gets to work on healing pretty darn quick. And this one is my favorite, because it shows you what's physically happening. When the cause is a herniated disc, MRIs show that about 75% of those discs actually shrink or are reabsorbed by the body within 2 years. So it's not just that you feel better, the physical issue itself is often literally disappearing. How cool is that?
Okay, so if our bodies are so great at healing, what can we do to give them a helping hand? Well, that brings us to the physiotherapy playbook, the specific, detailed strategies that are proven to help manage this and get you back on your feet.
A really solid PT program is a multi-pronged attack. You've got strengthening, and we're not talking about bodybuilding here. We mean targeting those small, deep muscles in your neck and shoulders that create a stable platform for your head. Then you have stretching, which is all about gently regaining your range of motion. Next is manual therapy. This is the hands-on stuff that a physical therapist can do to help calm the nerve down and improve movement. And finally, don't sleep on aerobic exercise. Just walking or biking improves blood flow and creates an amazing environment for healing throughout your whole body.
So, how does this all come together? It's a journey, really. It's not just a bunch of random exercises. A good PT will start with a deep dive, a thorough assessment to figure out exactly what's up. Then, step 2 is all about getting that initial intense pain under control and educating you so you're not scared anymore. Once things are calmer, you move into a targeted exercise program built just for you. And maybe the most important step of all, step 4, giving you the tools for self-management so you're in the driver's seat for the long haul.
Now, this all sounds great in theory, but it leads to a big question. How does this approach stack up against something more drastic, like surgery? Well, the science on this is pretty eye-opening.
To get a real answer, we have to look at the best kind of evidence we have, a randomized controlled trial. This is the gold standard in research because it directly compares treatments and cuts out as much bias as possible.
So, in this landmark study, they had 2 groups. Group 1 got a really well-structured physiotherapy program. And that's it. Group 2 had a major neck surgery, a fusion no less, and then they got the exact same PT program as the other group. This setup is perfect, right? It lets you see exactly what difference the surgery made.
And here's the bombshell result. After 2 years, when they measured actual physical function, things like neck endurance and hand strength, there were no significant differences between the 2 groups. Let me say that again. The people who only did PT
had outcomes that were just as good as the people who had surgery plus PT. That is a game changer.
So let's wrap this all up. What are the big takeaways here? Number 1, try not to panic. The prognosis for this is fantastic. Number 2, a well-designed physiotherapy program is an incredibly powerful, science-backed solution. Number 3, for so many people, structured exercise can get you the same results as surgery in the long run. And that leads to the big one. Number 4, physiotherapy really should be your first plan of attack before even considering going under the...
So we'll leave you with this question. When you're dealing with something as scary as a pinched nerve, it's easy to think you need a drastic solution. But what if the sharpest, most effective tool in the box is actually the one that helps your own body do what it does best? What if it's just smart, structured exercise?